California is facing a $32 billion deficit. That is up $9 billion from what was originally predicted in January.
Governor Gavin Newsom updated his final budget proposal today. Our political reporter Morgan Reiner has more tonight on what's behind the shortfall.
My big question for the governor: how does the state go from a $100 billion surplus and sending out checks to Californians last year to now facing a $32 billion deficit? He told me it's simple. California relies on its progressive tax structure, aka the rich, a graph that goes up and down.
There's a $32 billion gap in the budget, but Newsom says don't fret.
Well within our capacity to address.
So how is he going to make up for it? By delaying some funds, pulling back money that wasn't used from last year's tax refunds.
About $200 million that we can sweep back from that.
He also proposed some cuts to climate and public transit funding. And then for climate spending, he wants to borrow money in the form of 2 bonds the voters would have to approve.
I think it will be overwhelmingly supportive. And what more evidence do we need on climate?
Despite the deficit, the governor actually increased his spending in the budget. Newsom is putting a record $15.3 billion towards the homeless crisis. But the money comes with strings attached. Local governments only get the money if they submit good action plans.
We are going to assert our rights, and we're going to assert the rule of law in the context of actually achieving these goals.
In January, Newsom said he didn't want to tap into the state's reserves, but Friday he announced he would be taking $450 million from reserves to address growing Medi-Cal and CalWORK needs, 2 safety net programs. That's on top of the billions already allocated. California covers the cost of health care for low-income Californians, regardless of immigration status, and Newsom said they were seeing an increase in enrollment.
Can you explain the state of the social safety net programs in California when it comes to the increase we're expected to see in the state with the end of Title 42 and whether or not the budget can handle that increase?
Better to invest in a vaccination than into taking care of someone's chronic disease. That's our approach to health care. We believe more people covered, it stabilizes that coverage and cost for everybody. We don't believe in sick care.
Now comes the challenging part. The governor has to work with the legislature to approve the final budget. And the legislature has some different ideas of how to go about this. The Senate proposed increasing taxes on big companies to help out, something Newsom said he did not want to do. He pointed to the fact that the state taxed so much last year, they had to hand back checks.